Do you have symptoms in this area? Would you like to find out, is there nerve-related issues present on the background? In this video, I'll show you how to test both symptomatic and non-symptomatic signs and guide through simple and more advanced nerve gliding exercises. Nerve-related symptoms often include tingling, numbness, prickling sensations, electric shock-like feelings, and, in some cases, muscle wasting in the area innervated by the nerve. Here's how you can easily test the difference between symptomatic and asymptomatic signs. Stand up and raise your arm straight overhead about to 120 degrees. Then tilt your head to the opposite side. Thus the symptoms get worse. Next, while keeping your head tilted, bend your wrist so that the back of the hand moves towards you. If there is a significant difference between the two sides in this test, it's a good idea to start with the gentle nerve gliding exercises. Let's begin with the simple nerve mobilization exercises. First is called no more dishes. Extend your arms straight in front of you with the backs of the hand facing your face. Then, alternatively, pump your hands from bent position forward your torso to straight position in front of you. For an easier version, keep your arms below the shoulder height. To increase the stretch, raise the arms slightly upwards. You can also use ball for the gentle exercises. Start by tossing the ball to the wall with your symptomatic hand. Once it feels easy, progress to overhead throws. For more advanced nerve gliding exercises, try these. Place your palms together and glide the hands horizontally. If your knees can handle it, you can try crawling on your fours with your wrist bended upwards. Adjust the tension of the lowering of the chin for more stretch or lifting it for the less. Another option is the standing rotation exercise. Keep your arms at your sides and rotate your hands. When looking at the one hand, make sure the palm is facing upwards. For added stretch, gently bend the wrist downwards while the opposite palm faces downwards. To stretch the median nerve against the wall, place the palm of the hand to the wall and gently push your body away using the symptomatic hand. If you want to increase the stretch, you can always increase the external rotation to have it more stretch feeling. If the exercises cause significant pain or your face tightens in discomfort, reduce the intensity. The goal is to gradually increase the nerve mobility. As symptoms ease, you can progress to more advanced exercises. Each session should last about 2 minutes, and it's best to repeat the exercises 3 to 4 times through the day. After each set, test again and see if the difference between the size has reduced. Once the symmetry achieved, continue the exercises for 7 completely symptom-free days. If you want to learn more about this common nerve issue, make sure to check this video.